Welcome to This Week in Ophthalmology. This week we are covering 10 notable papers spanning 3 major areas: optimizing glaucoma monitoring and preventative therapies, refining safety and outcomes in retinal disease management, and understanding patient-centered trajectories in ocular surface and systemic inflammatory conditions. Let's dive in. We begin with new clinical insights into glaucoma management, starting with a large-scale cohort study. Ocular hypertension is a primary risk factor for primary open-angle glaucoma, and while nicotinamide has shown neuroprotective potential in laboratory models, real-world data have been limited. This study evaluated de-identified electronic medical records from a federated research network of 67 United States healthcare organizations between March 2006 and March 2026, matching over 1,400 patients, taking nicotinamide with an equal number of controls. The propensity score matched sample had a mean age of approximately 54 years, and about 59% were female. Over a mean follow-up of nearly 4 years, the researchers found that primary open-angle glaucoma was diagnosed in only 3.5% of the nicotinamide group, compared with 9% of the control group, representing an absolute risk reduction of 5.5%. Furthermore, patients taking nicotinamide were less likely to initiate topical intraocular pressure-lowering therapies, with a rate of roughly 14% compared to 21% in the control group. They were also less likely to undergo laser trabeculoplasty, which was performed in 0.8% of the nicotinamide group, compared to nearly 2% of the control group. These findings suggest that nicotinamide could serve as a valuable, low-risk adjunctive strategy to delay disease progression in ocular hypertension, though prospective randomized trials are needed to confirm these benefits. Next, we turn to the practical utility of visual field testing. Writing in the journal Ophthalmology, researchers evaluated whether the 10-2 visual field test provides additional value over the standard 24-2 test for detecting central visual field progression in early glaucoma. In a prospective longitudinal study of 96 early glaucoma patients and 56 healthy controls followed for a median of over 4.5 years, with up to 13 pairs of tests, the investigators compared the central 12 points of the 24-2 test directly against the 10-2 test. When looking at global or quadrant mean deviation slopes, there was no significant difference between the two tests in their ability to distinguish glaucoma progression from healthy controls. At a 90% specificity for the global mean deviation slope, the overlap in patients classified as progressing with both tests was only 53%. However, pointwise analysis revealed that the 10-2 test was superior at detecting progression when using steeper slope cutoffs of negative 1.25 decibels per year or worse. Patients who showed progression exclusively on the 10-2 test tended to have worse central visual field loss at baseline. For the practicing clinician, this suggests that while routine 10-2 testing may not be necessary for all early glaucoma patients, it remains highly valuable for monitoring individuals who present with pre-existing, localized central defects. This need for targeted monitoring is further emphasized by a long-term cohort study, which followed 274 Asian patients with normal tension glaucoma for an average of 13 years. The patients were treated with topical medications and followed for more than 5 years. The researchers sought to characterize fast progressors, defined as those losing more than 1 decibel of mean deviation per year. Approximately 11% of the cohort fell into this fast progressing category, experiencing an average loss of over 1.6 decibels per year, while 16% showed moderate progression and 73% exhibited slow progression. The study identified 2 primary modifiable risk factors associated with this rapid decline: the presence of disc hemorrhage and an insufficient percentage reduction in intraocular pressure. Notably, progressors with disc hemorrhage exhibited significantly faster functional progression compared with those without disc hemorrhage. Clinically, this reminds us that normal tension glaucoma is not always a slow-moving disease, and the detection of a disc hemorrhage should prompt clinicians to aggressively lower intraocular pressure, even when baseline pressures appear normal. Moving to the posterior segment, we examine the real-world performance and safety of advanced retinal therapies. A systematic review and meta-analysis in Survey of Ophthalmology evaluated post-approval outcomes of voretigene naparvovec, also known as Luxturna, which is the first approved gene therapy for patients with biallelic RPE65-mediated inherited retinal disease. The pooled analysis confirmed that real-world patients experienced statistically significant improvements in full-field stimulus testing of 2.2 log decibels and a small but significant improvement in visual acuity of 0.08 log mar, which actually exceeds the visual acuity changes observed in the pivotal Phase 3 clinical trial. However, the meta-analysis also highlighted a safety concern not formally documented in the clinical trials. Chorioretinal atrophy occurred in 30% of patients overall, and in half of the patients, it occurred outside the retinotomy site. While the long-term clinical significance of this atrophy remains uncertain, it underscores the necessity of close ongoing fundus surveillance in all patients receiving gene therapy. In intermediate age-related macular degeneration, identifying reliable imaging biomarkers for progression to geographic atrophy is a major clinical focus. A study in the American Journal of Ophthalmology used swept-source optical coherence tomography to investigate whether hyporeflective core drusen are associated with the onset of large choroidal hypertransmission defects, which serve as a surrogate for atrophy. Evaluating 171 eyes from 121 patients over a median of nearly 5 years, the researchers found that 82 eyes developed at least one large hypertransmission defect during follow-up. However, the total area of hyporeflective core drusen was not a significant independent predictor of progression to atrophy in univariable or multivariable Cox regression models. Instead, the risk of developing large hypertransmission defects was driven primarily by the presence of calcified drusen, regardless of whether they contained hyporeflective cores. This suggests that while advanced imaging algorithms can segment subtle drusen characteristics, clinicians should maintain their primary focus on broader calcification patterns when risk stratifying intermediate macular degeneration. Patient safety in the operating room remains paramount, particularly regarding the use of intraocular gases. A study in the British Journal of Ophthalmology analyzed national patient safety incident databases in England, alongside a surgeon survey to address errors in the preparation and dilution of fluorinated gases during vitreoretinal surgery. Out of 47 reported incidents, 29 involved incorrect gas concentrations, with 14 resulting in moderate to severe harm, including 8 cases of blindness or severe visual impairment. These devastating outcomes, often caused by the inadvertent administration of pure undiluted gas leading to central retinal artery occlusion, are entirely preventable. Among 108 surgeon respondents, nearly 39% recalled at least one significant complication related to incorrect gas concentration. The expert panel recommends standardizing dilution protocols, implementing mandatory 2% verification steps, utilizing color-coded labeling, and employing post-operative patient safety wristbands or cards to prevent these catastrophic surgical errors. The risk of acute vascular occlusion is also the subject of a large-scale retrospective cohort study in Ophthalmology Retina, which analyzed the 5-year probability and predictors of fellow eye involvement after a unilateral retinal artery occlusion. Utilizing the Trinetics database of over 19,000 patients in the United States, the study found that fellow eye occlusion occurred in approximately 4% of central retinal artery occlusion patients and over 3% of branch retinal artery occlusion patients within 5 years, with central retinal artery occlusion carrying a significantly higher risk. Notably, these events were highly front-loaded, with the risk rising most rapidly within the first 3 months. The study also revealed a strong concordance in subtype, meaning patients with an initial central occlusion almost always developed a central occlusion in the fellow eye. In patients with central retinal artery occlusion, key baseline predictors of bilateral disease included carotid stenosis, cerebral infarction, hypertension, diabetes, and sleep apnea. These findings emphasize the critical importance of immediate comprehensive cardiovascular workups and close bilateral surveillance in the acute post-occlusion period. Next, we look at patient-reported outcomes and surgical techniques in the anterior segment. A prospective multi-center cohort study. While nearly 29% of patients reported no clinically relevant pain and 44% experienced pain only on the first post-operative day, roughly 18% suffered from prolonged pain lasting 3 to 6 months. This prolonged pain trajectory was independently associated with receiving photorefractive keratectomy, preoperative lubricating drop use, chronic low back pain, and a higher baseline dry eye symptom score. Interestingly, the presence of corneal staining at 6 months was actually associated with lower odds of prolonged pain, suggesting that the underlying mechanism of persistent discomfort may be neuropathic, rather than purely related to ocular surface dryness. This highlights the value of preoperative screening for chronic pain conditions and dry eye symptoms to better counsel and manage patients at risk for prolonged postoperative pain. For patients suffering from severe corneal anesthesia or neurotrophic keratopathy, restoring sensation is vital to prevent corneal perforation. A systematic review in the American Journal of Ophthalmology compared the clinical outcomes of using autologous nerve grafts versus processed nerve allografts for indirect corneal neurotization. Analyzing 11 studies representing 150 eyes, the authors found that both graft types led to substantial improvements in corneal sensation, with mean Cauchy-Bonnet esthesiometry scores increasing from baseline in both cohorts. Visual acuity improved in over 60% of patients in both groups, and persistent epithelial defects resolved in the majority of cases. While autografts carried a small risk of mild donor site morbidity, no graft rejections were reported in the allograft group. Given the lack of clear superiority of one technique over the other, the choice of graft can be tailored to surgeon preference and graft availability, though higher quality comparative trials are still needed. Finally, we address systemic management strategies for non-infectious uveitis. A multi-center cohort study in ophthalmology compared the 5-year risk of systemic complications in patients treated with biologic therapies versus conventional immunomodulatory therapies. Using propensity score matching on data from the TriNetX network, the researchers found that compared to no systemic therapy, biologic treatment was associated with higher 5-year risks of serious infections, such as pneumonia and sepsis, as well as hematologic cytopenias. When compared directly to conventional immunomodulatory therapy, biologics demonstrated a broadly comparable 5-year safety profile, with the primary exceptions of higher rates of cytopenias, psychiatric illness, and all-cause hospitalization. These findings support a cautious, stepwise approach to immunosuppression in uveitis, emphasizing the need for regular hematologic monitoring and vigilant infection surveillance when escalating patients to biologic agents. If you only have time for one paper this week, make it the cohort study on nicotinamide supplementation in ocular hypertension. This study provides the first large-scale, real-world evidence that a simple, low-cost oral metabolic supplement is associated with a substantial reduction in the risk of primary open-angle glaucoma conversion and a delayed need for subsequent medical or surgical interventions, offering a highly practical adjunctive option for our ocular hypertension patients. Here are the key takeaways from this week in ophthalmology. First, systemic nicotinamide supplementation is associated with a significant reduction in the risk of primary open-angle glaucoma conversion and delayed treatment escalation in patients with ocular hypertension, suggesting a potential role as a low-risk, oral adjunctive therapy. Second, routine 10-2 visual field testing does not offer additional benefit over 24-2 testing for detecting global progression in early glaucoma, but it remains highly valuable for point-wise monitoring in patients with pre-existing central defects. Third, the real-world use of voretigene neparvovec gene therapy is associated with high rates of chorioretinal atrophy, occurring in up to half of patients outside the retinotomy site, which necessitates vigilant, long-term fundoscopic monitoring. Fourth, the risk of fellow eye involvement after a unilateral retinal artery occlusion is significant, highly front-loaded within the first few months, and strongly predicted by systemic vascular risk factors, emphasizing the need for immediate systemic workup and close bilateral follow-up. Fifth, roughly 18% of patients undergoing laser refractive surgery experience prolonged postoperative pain lasting 3 to 6 months, with risk factors including photorefractive keratectomy, pre-existing dry eye symptoms, and chronic systemic pain conditions. That's your roundup for this week in ophthalmology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.